All right, let's go ahead and talk about some terminology with reference to radiographic pathology. The biggest takeaway from this should be to define these terms and concepts. So let's start here with carcinoma. Carcinoma just refers to a malignant growth, which often spreads to other places in the body, and that's what we call metastases. Congenital is something that somebody has from the moment they're born. In x-ray, we might see this as, let's say, a pediatric patient with more than 5 toes. Diagnosis is really what we're here for. That's what we're trying to help the patient with. When we get an x-ray, the radiologist can take that x-ray and try to diagnose from there. A diagnosis is just when a disease is identified within a person. So let's talk about disease for a minute. So disease is an abnormal disturbance of the normal function or structure of a body part, organ, or system. Next up, we have dysplasia. Dysplasia is an abnormal tissue development. Iatrogenic is going to be a condition which arises from medical care or treatment. So this could be something like a bladder infection that results from a urinary catheter while somebody is having to stay in the hospital. Idiopathic is when the cause of the disease or process is unknown. Inflammatory, and then we have stages of response in our PowerPoint this week, but inflammation is really just the body's response or process of destroying or walling off a localized injury. A lesion, we'll see this word from time to time. It's just a various type of cellular change that occurs in response to disease. So it can be used in a few different instances. Malignant neoplasm, that's another cancerous term. It's a mass or lesion that grows and spreads. That's something we definitely don't want to see. Morbidity and mortality. So morbidity is the rate of illness in a population, whereas mortality is actually the rate of death from a particular disease averaged over a population. In recent history, we can see these two terms used quite a bit with reference to, unfortunately, the COVID-19 pandemic. The next term, neoplastic, is pertaining to new abnormal tissue growth. So that's another term we see a lot when we're talking about cancer. Prevalence is going to be the number of cases of a disease within a given population. And finally, signs versus symptoms. Signs is a manifestation of a disease, and it's something we can measure. So when we're taking blood pressure or checking temperature, that's going to be a sign. On the other hand, if the patient comes in and says that they have a headache, that's going to be a symptom, something we can't quite measure. All right, so we also need to talk a little bit about technique changes. Technique changes are very important. It's one of the big takeaways from this entire class. So real fast, on page 3 of your textbook, you can find basic definitions that will carry you through the rest of the semester. So a destructive disease, that's going to be something which kind of takes away tissue or decreases the compactness of it. It's kind of like more air in the lung field, for example. On the other hand, we also have additive diseases. So if we're looking at an additive disease, we're going to see fluid being added into the anatomy of interest or more compactness. And so without even knowing anything about what this chest pathology is, we can use our background knowledge and everything we know so far to say, okay, I should be seeing a darker area here, because usually there's just air in the lung, but instead I'm seeing these additive portions because tissue is being added in this disease process. Because overall it is additive, that means what we're going to do is increase technique. It's kind of like saying, because we have more tissue that we're trying to get through, ultimately we need more x-rays. And then the opposite is can be said for a destructive disease.